the interest in this topic area. I can tell you from my kind of perspective, having worked in this field for, quite a few years now, there's definitely more and more interest, which is very nice. And mental health is one of those issues that I feel, maybe about 10 years ago was not getting as much as attention as it needed to. And we're finally starting to put this front and center in all of the climate action work that we do. Harry, did you want to add anything before I get started?
No, just to tell that what we're going to do today is kind of give you a broad overview. We're not going to probably get into a lot of detail, but it's more geared towards just making you aware of some of the kind of the key areas that are being worked on and discussed and looked at in terms of climate-related health and particularly mental health.
Perfect. Thank you for saying that, Harry. Just one other thing. Do you see the slides or do you see my notes? The slides? Okay. So
Slides.
not my cheat sheet, right?
No, just the slides. Yeah, you're good.
Perfect. Okay, so let's just dive into this. I think the way Harry and I kind of kind of structured the next 50 minutes was I, being a public health professional, public health background, for myself, I'm going to be providing a very broad-based overview of this issue. And Dr. McDermott, with his clinical expertise, will dive down a little bit deeper, and I think hopefully bring it, bring it more home to all of you, and in the field that you're kind of practicing in. And then we'll conclude just, opening it up for question and answers. If you have questions that you think of, feel free to put them in chat. I'm really bad. I cannot multitask. So when I'm presenting, I can't see if you're putting something in chat. So if you are doing so, I'm going to lean on Brian and Harry. I'm happy to, I'm okay getting interrupted and, digressing, because this is about making the session meaningful for you and not so much for us to get through all of the slides. So having said that, a little bit of a quick overview. I always start with an inverted pyramid, starting very broad and then getting narrower and narrower into the topic area that we're talking about. I think you've had a few lectures on this topic, on the broader area of climate and health. So we know, right? We know there's direct impacts to human health and well-being. We can usually quantify them, so to speak, by looking at health outcomes. So mortality, morbidity, those are some of the things. We also like to look at indirect outcomes. So, when there's a mediator, right? When there's a mediator, there's, the climate, whether it's increased temperatures, increased humidity, that impacts the spread, the range of a vector. And so that vector is more viable, or is now found in geographic locations where they might not already be found. And so hence we have an increased risk of vector-borne diseases like West Nile virus, dengue hemorrhagic fever, dengue fever, so on and so forth. So we kind of try to think of them as direct and indirect impacts of a changing climate. I think another way to look at these also is keeping in mind that, and I come from a background in emergency preparedness. We often tend, as we work in this space, we often look at these in isolation. We have one and not the other. And one of the, I think this is my next slide, yep. And one of the things to really, that's important to understand when we're looking at climate health impacts, including mental health impacts, is we no longer can operate in this frame of mind where disasters are happening or exposures are happening in isolation. We're increasingly finding ourselves in a world where we have an increased frequency, duration, and severity of disasters. And so it's no longer we're going to have a hurricane and that's it. and we'll have time to recover from it, work in our communities. No, it's going to be hurricane, widespread flooding. We might have landslides moving forward, right? It's just one thing after another. We call these cascading events, storms of crises. That's another term. Talk about mental health, right? These are all doom and gloom kind of terminology we use. Um, I think this is a really neat graphic. It is an outdated graphic. I think this is from National Climate Assessment 3, maybe. So quite a few years back. Um, Catherine Hayhoe, if you're really interested in this topic, she has a YouTube channel. It's called Global Weirding. She makes this very palpable. The science is more easy to understand. So I would highly encourage you to look at it. But she's used this graphic as well. But by and large, what we're trying to say is the range of time where we would expect to see like a season, for example. Let's pick on heat for a moment. If that heat season, a decade, 2 decades ago used to be June, July, August, now what we're seeing is shifts, right? Shifts in the climate, which then result also in shift in risk and exposure. So then our tails on the cooler end get smaller, right? Or shorter. And then our tail, and on the other side, the right side of the bell curve, what we end up having is more hot, more extreme temperatures and weather. We saw that especially last year. Phoenix area, 119 during the day in the summer, and nighttime when we expect, right, our urban heat island effect, we expect to cool down a little in the evening. That didn't really happen so much. Nighttime temperatures were up in the 98s and 99s. So those are new dimensions in this climate and health phenomenon that we really have to um, pivot to take into account as we inform solutions, as you practice, because these will have ramifications on people's behaviors. So by and large, bottom line, climate change is a risk amplifier. I think we kind of understood that. Um, you know, and I won't go into this slide in detail. I think, I've touched on some of this already, but as we look and work in this phenomena, especially in considering the mental health impacts of disasters, what are the ramifications? What is the behavioral change that occurs when individuals are repeatedly exposed to floods, or they are repeatedly having to evacuate, right? If they live in an area, whether it's a wildfire prone area or a flood or hurricane prone area, there's a cumulative impact on human health and well-being, including mental health, that we're just starting, research is just starting to pick up on and starting to understand. When we do climate and health work, one of the key kind of lens or approach that we take is looking at our vulnerable populations, right? Who's at risk? What makes them at risk? There's individual level factors like your gender, your age, but then there's also community level factors, where you live, what kind of assets or resources are available in the community that you live in. Are you in a rural community where you don't have easy access to healthcare, right? All of those things, do impact your ability to absorb those shocks and stressors, and then thereby also feed into what kind of response behaviorally, mentally you're going to have. And we'll get into this a little bit. It's right here. Yep. So another kind of layer, think of this like as an onion, right? We talked about risk, we talked about vulnerability, we will talk about health inequities. Another layer of this kind of vulnerability part of the onion, so to speak, is recognizing the populations that are at risk. I think one of the newer, not so much newer, but I think we're finally starting to kind of recognize this and draw more attention to it, is this, risk and vulnerability changing across the lifespan. Right. So we're often, when we think of vulnerability, we'll think of, oh, it's someone who's in a certain occupation, right? Or those individuals that have pre-existing conditions that put them at more risk. But there is a new body of literature that's coming out that's really starting to highlight that as we age, and different age groups have different vulnerabilities that also change because their adaptive capacities to a changing climate also change. From a public health policy and management perspective, which is the lens that I bring in, it's really important to consider, how do we build programs that are able to reach these disparate populations, right? Not just looking at social determinants of health, but also different age groups and what kind of considerations we need to be making when we make, for example, urban planning decisions. So, this is a pretty wordy slide, so I'm just going to take a minute and just draw out some of the key components. Um, Let me just minimize this real quick. So, when we think of mental health, we often find ourselves thinking about this issue as my second slide indicated, which is it's an impact from a disaster, right? We are tending to see more anxiety, more stress, more PTSD, because after someone has survived, right, and lived through a life-changing, stressful event, such as a natural disaster. But we're increasingly beginning to realize the mental health impacts. I think Brian mentioned this earlier. One of you has touched on this as well in prior sessions. Eco-anxiety, mental health, impacts even prior to an event. The anticipation of what's happening with the climate causing a stressful response at the individual level. We're seeing that a lot with youth. We'll touch on that in a minute. But so from a you know from a bigger picture kind of perspective, I think it's important to recognize that, yes, looking for those indicators, looking for those, um, behavior responses after someone's experienced a life-changing event, but then also recognizing that, it's not that direct impact. It's also some of these impacts. Well, do you have someone, one of your clients or your, sorry, client's the wrong word, the wrong field. One of your patients, right? Maybe they have family that's living in an area that was hit by a disaster. Mental health impacts carrying into that individual, and how do we respond? Um, not being a clinician myself, so I'm not going to go into this a lot. I'm going to leave it to Dr. McDermott. But, I think from my perspective, the outsider in, the diagnosis and the treatment is a concern, but equally important, I think, is going to be for the health profession is going to be really thinking outside of the box, looking at the individual as a whole, right? In that all that time that you have when you're one-on-one with a patient, and really looking at that social determinants of health inequities lens, when we're trying to connect people with that treatment. Is it that could that treatment be something as simple or as complicated, depending on the way you see it? Could it be something as simple as, making sure people have ways to be connected, right? Social connectedness, have a way to let those kind of behaviors and energies transition to and use them, channel them to do something that's meaningful in the community, maybe, or going out into nature. There's a whole body of literature that speaks to the benefit of, green and blue kind of infrastructure or spaces, that I think Dr. McDermott will get into. Okay, hold on, this is not going. There we go. Um, so as we work in this area, we touched on vulnerable communities, right? We know there's across the age. Sorry, I have a pop-up keep on coming up. But also looking at occupational exposures and what are those indicators that we can, diagnose, right? You probably have certain kind of benchmarks or thresholds that can be met, and someone can be diagnosed with anxiety or PTSD or suicidal thoughts. those are all going to be very expensive to my knowledge. And someone correct me if I'm wrong, at least as of a couple years ago, there aren't really hard and fast metrics to diagnose some of those, like eco anxiety, solastalgia, right? That can help you as a clinician figure out, okay, well, this person is meeting this threshold, hence this is what I need to do. I don't think those kind of decision frameworks are there yet. I think that's an area of work that still needs to be done. Again, correct me. You all are the experts on this. Correct me if I'm wrong on that. I'm going to pivot here for the next few slides. I'm going to, my focus area as a public health person is really focusing in on not just the response as a result of a disaster, but also looking at what the trends say and how do we get people to change their behaviors to do something about this issue. So internationally, a lead agency that works on this is Yale Climate Change Communication Program. Look them up. They're the ones that come out every year or two with these really fancy maps that tell, what do U.S. residents think of climate change. And I picked on a couple of these just to start getting some thoughts going around where we sit, in the United States, where how people feel about this. So what's on your slide is the estimated percent of adults who think global warming is happening. This is as of 2021. And as you can see, 72% of folks seem to think on average that climate change, global warming, yes, it's occurring. When we ask them if global warming will impact them personally, that percentage goes down. By and large, about half of our population, or half of the individuals that were surveyed in this national sample, don't feel they're at risk. So they don't feel they need to really do anything about it. Okay, how many are worried about global warming? So they recognize it's happening. Are they worried about it? 60%. So, those numbers I think have changed over the course of time, but it speaks to where when we're talking about climate change, how do we want to frame that discussion, right? What is going to be resonating to people? Here's just another, you will have these slides. So just, thinking about how do you approach conversations when where your communities might be um, might be resonating on this spectrum of belief. Another kind of example speaking to the same thing, 67% of Americans agreeing climate change is already impacting their population's health. 55%, half of individuals surveyed in this study, indicate Americans are anxious about the impact of climate on mental health. 50%. Similar vein, wide range of emotions, sad, afraid, um, angry, right? And among our youth, we're starting to see this a lot of anger, but then a lot of depression and grief as well. I'm going to rush through my next couple slides because I do want to give Dr. McDermott the time to get for his work. But just touching on this one right here, I think going back to the earlier comment, putting the former slides together with the vulnerability slides. Those who are individual, they might be more kind of perceiving of the impacts and the threats to their livelihood climate change brings, sorry. And that's going to be a facet, I think, that's going to be really critical both from a healthcare and public health lens. The National Climate Assessment, the fifth National Climate Assessment just came out this year. I would highly encourage you to look into it. There are a couple kind of focus areas where they really highlight mental health as a critical issue that we need to work on. Again, this report also underscoring the impact of a changing climate on specifically children and youth, having a 3 to 6 fold greater odds of having anxiety if they've gone through an adverse childhood event. So, why this is important, I think for a variety of reasons. I think as we look at adaptation mechanisms, mitigation programs, starting to think about the co-benefits of these policies, whether it's, having another park, making sure we get more bike lanes, there are health co-benefits to that. And I think what the healthcare sector brings to the table is helping policymakers and decision makers recognize, hey, by doing this, there's going to be benefits to health, human health and well-being. Because that's really, I think, often is that what we see is a convincing argument for people to hear is, yeah, there's an economic benefit, but there's also a health benefit. I will stop here. I will turn it over to Dr. McDermott. Sorry, Harry, I took a couple more minutes than I had planned.
No, you were fine, Mona. I think we're doing fine on time. Let me share my screen now. Can everybody see that okay? Okay. First of all, I wanted to say I'm very pleased to be invited to talk by Dr. Drummond to talk about this topic today and to meet with all of you who I'm glad to see have some interest in climate and health in general. And I wanted to also congratulate all of you on matching with residency programs recently, and hopefully you all got the matches, top choices that you wanted. But Brian was telling me a little bit about where some of you or most of you are headed, and it sounds like we're spreading you all over the country. A couple are staying in Arizona, but you're all going off to do interesting and good programs, and I congratulate you on that. It's hard to believe too that some of you I recognize from clinical reasoning, and now congratulating you on soon to be graduating. That just doesn't seem like it was that long ago we were doing clinical reasoning. So, but again, I'm happy for you all. So let me get into my topic here. And let's see, is that? I'll do it this way. There we go. I'm going to start with this kind of graphic, this image, which includes some of the things that Mona had mentioned in her comments. Also, some of the things that were talked about in the video that you all have access to by Drs. Cooper and Trope from UC San Francisco. I thought that was a very good video on psychiatry and climate. They did a really good job of giving you kind of a good overview of that topic. And Dr. Trope particularly mentioned, talked about the acute events versus the chronic or long, the events that tend to evolve over a longer period of time, what is referred to here as chronic events. And this shows again some of the impacts of some of both these acute events and these chronic events. I would also say that you can make a case that it's the chronic events are contributing to the acute events, so you could actually draw an arrow here, as well as the fact that you can have both happening. You can have a chronic event that sets up an acute event that then occurs on top of the chronic event. So you have an acute on top of a chronic event. One of the examples he used, which was a good one, was the Camp Fire and the destruction of Paradise, California. But that was the culmination of an almost decades-long drought in California, in that area of California, that set up that massive wildfire that then ended up basically destroying that community. And then, of course, you probably, if you watched the news during that time, saw and heard about some of the significant threats to economic and social well-being that occurred after that event. And then he also did a nice job of kind of talking about the phases that occur after an event like that in terms of the response and individual response, including that there tends to be a rise in community cohesion, which kind of gives people a bump in their emotions initially. But then as the extent of the loss sets in, you start to get factors like grieving the loss, and then you may get into depression and anxiety, depression around the loss and anxiety about what's ahead. And again, that'll all depend on the circumstances of that recovery. He also mentioned disillusionment can occur then too, depending on how much help people are getting with that recovery or not, or what their expectations were and how those expectations are being met or not. And then there's also the issue that people don't talk about of survivor guilt. People who survived that were, some of them felt guilty that others were killed. And you heard in some interviews, people said, I wish it was me. I wish it was me and not them. And so that's another aspect of all of this. And again, leading to the things at the top of that: PTSD, depression, anxiety, suicide, aggressive behavior, and then potentially severity to the point of hospitalization. And on the right is kind of gets into the eco-anxiety, climate anxiety aspect of it. And mainly it's deals with the perceptions people have of what their risk is, the extent of the risks, and the potential impacts to them for those particular risks related to climate and weather, as to whether they go on to form more and more anxiety around that particular topic. On this slide, Mona talked a good bit about, which was I'm glad to see, about the vulnerability, the populations of concern, I also call them. And this is a listing that you could see on her slides as well. What I want to point out here, the key thing I want to point out here is this area right here, these elements of vulnerability. So I'm going to go take vulnerability a step a little bit further and say it has these three particular elements to it that can tell us how vulnerable somebody may be. One is exposure. What's their risk for exposure to these kinds of events? And so, as an example, if we're having, we'll talk about mental health conditions, people who are, more dealing more with poverty, with homelessness, with being unhoused or insecure housing, inadequate housing, may be at greater risk of being more vulnerable to potential weather events. The exposure, probably the classic example of exposure is they have the listed occupation there. Folks who work outside, construction workers, farm workers, they have the potential to have the greatest exposure, say, as an example, around heat, and some of these other, and maybe even some other weather-related events. Sensitivity can also be having an underlying mental health condition that makes you more vulnerable, more sensitive to the negative mental health impacts of a particular event. Also being on psychotropic medications, because most of the psychotropic medications do affect thermal regulation in a negative way. And so that can create a sensitivity for people who are on those medications as well. And then the adaptive capacity, that's basically the resources that are available that could help a person adapt to an event like that. And again, if somebody is has access, say has a mental health condition, they have certain services that they access to help support them in caring for that mental health condition. But if those services then become negatively impacted or disrupted because of a climate event, what happens to those people? And that really reduces their adaptive capacity. It makes them more vulnerable. And they're more vulnerable if they rely on services that are more apt to be disrupted during a weather event. So again, I just wanted to point out those three elements of vulnerability just to add a little more nuance to the discussion about populations of concern. And then just another couple examples of some of this in terms of vulnerability and mental health. I'll particularly mention the area of the children. You can see, but one of the things that with children in particular, that you'll see if you think about some of the bullet points under the children topic, is that basically one of the things that makes them most vulnerable to negative impacts of climate events, it's extreme weather events, is that they have very little control. They have very little control over what's done to them or how to react to what's happening. They're basically relying a lot on parental support, and that then in and of itself can be a factor in how they respond in terms of how their parents respond, how the parents responds and how resourceful the parents are can have an impact on the child's mental health as well. If the parent is particularly stressed out by an event, or the potential for an event or a series of events, the children are going to pick up on that, and it's going to negatively impact them as well. And so that again is another kind of nuance to the vulnerability that children have, as one example. Indigenous populations are another one you can think about. They already probably have some level of prior trauma. They also may be dealing with issues of poverty and decreased access to services and inadequate housing. And then you throw the stresses of weather events on top of that, and that can trigger kind of negative coping mechanisms like higher alcohol and drug use. And then that all contributes to an increased risk for suicide and suicidal thinking. So again, just a couple of examples of some of the things that play into this vulnerability that certain groups may have. Mona talked about some about the epidemiologies for this. So for the sake of time, I'm just going to go through this one. And again, you all will have shared this slide set as well, my slide set as well with Dr. Drummond, including the set that he has the notes at the bottom of each slide and references as well. If you want to check those out, look at some additional information that's affiliated with each slide and check some of the references that are affiliated with each of the, or many of these slides. Climate mediated, exposures. Under mental health, the first bullet, the key things in there are frequency, unpredictability, and intensity. Those are three key factors that can play into how much of an impact weather events are going to have on people, and particularly on their mental health. The third and the fourth bullet, if you look at in terms of heat specifically, we do know that higher ambient temperatures will disrupt normal cognitive functioning. The higher temperatures reduce serotonin levels, which is one of the theories that is the cause for the increased aggression and irritability that people see with extended heat exposure, heat-related weather exposure. And then, also you have the cognitive impact of poor sleep, which is also found with rising temperatures. You need a certain level of lower temperature to have more restorative kinds of sleep. And the higher the temperature is, the less likely you're going to have that restorative sleep. And that'll affect cognitive function, as well as dehydration. We all know dehydration can affect cognitive function. And then I mentioned already that the psychiatric medications, a lot of the psychotropic medications, including SSRIs, lithium, the amphetamines, can all impair thermal regulation. Under the downstream consequences, that first section, extreme weather events and prolonged environmental changes lead to short and long-term effects, social and economic disruptions that can cause acute or prolonged chronic disruptions to mental health or mental illness exacerbations. And I think that just makes sense. The next couple of bullets there, specifically look at another vulnerable group, which is pregnancy and maternal child health. That even, severe stress can negatively impact neurodevelopment in utero for the developing fetus. And then after delivery in young children, I mentioned before, maternal stress will be picked up by children and negatively impact their mental health as well, the stress of the mother. another thing to consider with eco-anxiety is particularly in the teens where it seems to be more prevalent, and rightly so, because they're looking at this and we're also looking at this. They have increased life years impacted compared to, people in your generation are going to be dealing with this for a lot longer in your lives than people in my generation are. And so that in and of itself can start to impact people's mental health and lead to some of the anxiety that we see around climate-related change. In terms of going back to heat, just for some other examples, these are some of the elements that can impact the mental health outcomes of a particular event, an extreme heat event. Under the physical health, again, mentioned that if the people already have underlying physical health conditions, certain ones can be more negatively impacted by extreme heat and also contribute then to poor mental health. Time allocation goes more to that exposure I talked about. So people who are working outdoors for longer periods of time or for long periods of time, and that vulnerability that gives to them, or the fact that if they aren't working because of extreme heat, because it's just too hot to work, and so they lose wages, they lose time at work, they lose wages because of that. The emotional state regulation piece element goes back to what I mentioned about serotonin and increased irritability and aggression seen as the temperatures go up, and particularly for protracted periods of time. Cognitive function, already mentioned again that earlier, about things like sleep, which is another element down the line there, as well as dehydration, and increasing ambient temperatures in general can affect cognitive abilities. And then all underlying mental health conditions, already baseline or foundational underlying mental health conditions, compounded by extreme heat. And so what that does is it ends up giving some of the adverse outcomes we've talked about already: increased stress, anxiety, depression, increased aggression, which manifests, and research has shown this increase in rates of violence, of not only homicide, but things like domestic violence as well, and increased rates of suicide, which many psychiatrists think of suicide as just aggression turned inward. And then ultimately increased mental health hospitalizations because of all of this. Substance use impact with heat, again, sticking with kind of the heat example. Highest mortality is attributed to substance-related mental disorders with every 1 degree rise in temperature. And then you have the greatest increase in risk for visits to the emergency department for mental health concerns for those with substance use disorders. And then we talked about, I used the indigenous population vulnerability example, but it doesn't just apply to indigenous peoples. It can apply to anybody. Failure to gain relief from heat may trigger, poor coping mechanisms such as increasing alcohol use or other substance use. And as you probably are aware, alcohol is probably one of the worst substances you could be taking in when you're dealing with a heat situation, because as a diuretic, it's going to dehydrate you even further. Mona already talked and touched on these definitions, and you can see these definitions of solastalgia and eco-anxiety. Now, one of the things to be clear, these are not pathological diagnoses. These are not designated DSM-5 diagnoses yet, or at least at this point they aren't. I think what most people consider these to be is more reactive syndromes that are basically normal responses to abnormal situations. And so in a couple of terms that I've seen, in addition to these, for solastalgia, I've heard that referred to as climate-related grief, and eco-anxiety is climate-related fear. Another description of solastalgia that was interesting that I saw was described it as a place that had been a place of comfort now becomes a place of pain. And so that's where you get into the kind of the grief and loss piece of or a factor within solastalgia. But again, these are non-pathological entities or syndromes that are related to the climate change and uh, weather risks, related risks. They can eventually, you know, evolve into depression or anxiety, depressive disorders, anxiety disorders, adjustment disorders, and so on. And again, it's all a matter uh, of extent, you know, in terms of the extent or the intensity of the symptoms, the duration of the symptoms, and the coping mechanism of the person, whether um, the symptoms or things are getting worse or better, or whether it's impacting their ability to function on a day-to-day basis as well. Um, in terms of pathways to eco-anxiety, these are all elements, again, that can contribute to that. And they're all pretty self-explanatory. Um, and any one or combination or all of these can be contributing to the development of eco-anxiety in a particular person. This is to be separate from on the left. You see there the extreme weather events which can produce actual more pathologic mental health conditions or DSM-5 related mental health conditions such as anxiety, depression, PTSD. How am I doing on time? Okay. Almost done. Therapeutic approaches, you know, as I mentioned before, grief can be a significant factor in both the anxiety and the solastalgia, or the depressive effect of these dealing with these events. And so dealing with grief and loss as you would with grief and loss of any kind, whether it's the death of a close friend or family member, or other circumstances that lead to grief and loss. Psychotherapeutic approaches, this is an area that needs a lot of research still. There haven't been any that have been identified as particularly outstanding in terms of dealing or helping with eco-anxiety, although you could think that cognitive behavioral therapy might be one that probably over time will be shown to be helpful because it is so helpful for anxiety disorders. And there are more and more therapists out there who have an interest in this area and are starting to learn more about this area and experiment or do research into various psychotherapeutic techniques that might be of value for folks dealing with eco-anxiety. The couple bullets down there, Mona mentioned this a little bit. I will echo it again. Encouraging social connection and also purposeful action. Purposeful action gives them a sense of control, gives people a sense of control. So if you can help them identify things that they can do, actions they can take to start helping to mitigate some of the negative effects of climate change and change, environmental change and impacts on the climate and the environment, that's going to be helpful to them. And then also connecting socially, both to understand that, you know, they will realize that they're not in this alone, and those social connections again keep them from being isolated and can kind of bring down some of the negative mental health impacts that they're experiencing. Ecotherapy, it's other term for it is nature-based therapy. Things like you know, just recommending that people get out and spend more time in nature. You probably may have heard the term forest bathing. That's one of those that are considered ecotherapy or nature therapy. And then ongoing provider education, self-education. The American Psychological Association has a lot of resources now and educational programs around climate and mental health. And there's also the Climate Psychology Alliance that's out there now with also resources and educational programming. This is just, you know, I'm not going to go through this. This is put out by the CDC, and it's just kind of it could be a foundational way to start a conversation with patients about response planning. So and it's another way to give them a sense of control. Help them develop even a very basic plan of how they would respond in certain kinds of extreme weather events occurred, particular to your area. Like here, you know, heat may come up as the #1 topic people would talk about. And it helped, you know, using this to help start a conversation with a patient about developing a personal response plan, even if it's a very basic plan, something to get them started if something should happen, could be very reassuring to them and very helpful to how they respond. These are individual and community level interventions for the actual clinicians they talk about. You'll see some things in here, recommend nature prescriptions we talked about earlier. The other, it says follow best practice guidelines for mental health treatments. In other words, again, as we talked about, some of these kind of more normal responses to abnormal situations like the eco-anxiety can, in some people, evolve into more significant mental health problems. And so just if you get a sense that that may be happening, using practice guidelines to make the diagnosis and then initiate treatment based on those guidelines. Encouraging plant-based diet, again, to kind of decrease the impacts on the climate yourself, and then community level interventions. One I'll just give an example of: social prescription for nature-based solutions. Again, just trying to get the community to do things like plant more trees in neighborhoods that many times are underserved and lower socioeconomic neighborhoods, which in many circumstances don't have anywhere near the shade cover, the tree cover, or the green spaces that other areas of the community have. And so that could be one thing that you could advocate for. The other, on the video, Dr. Cooper at the end of that video talked a lot about advocacy, and she had some very good suggestions and resources for that. So I would refer you back there too. And just a couple of things I'll note on this, not going through the whole thing, but under engagement, again, just echoing again and reiterating, supporting action and connection. Under the community, again, that second bullet, vulnerable patients may require addressing external needs such as access to cooling centers. And so as part of those basic plans, those the individual response plans might be to make sure people know that the city of Tucson and Pima County have designated cooling centers that they set up during the summertime, where those are located, that many of them are on routine city bus lines. So it helps with transportation to those areas and so on. And then the three insights there, there is no one correct or best way of communicating about adaptive coping with climate change. I think that you just take a balanced approach is best. Consider providing information on risks paired with information on solutions. Also, tailoring your communication to how receptive or non-receptive you think your patient might be. Again, climate change can be a trigger term, a phrase for some people, and maybe you use something different, like climate-related weather events, kind of thing. So you don't trigger those automatic knee-jerk negative responses from some people around climate change. And then realizing that individuals exist in communities and ecosystems with resiliencies that are interconnected. So individuals can be resilient and can help improve the resiliency of their communities, and communities can be resilient and help improve the resiliency of their individuals, and ecosystems as well can be resilient and help with both on the individual and community level as well. And the last thought I'm going to leave you with is that vulnerability and resilience are not mutually exclusive. So as an example, these are three groups that were listed under those vulnerable or populations of concern. But if you consider it, aging adults may be a vulnerable population, but there are also people who have rich life experience. They can act as community leaders, mentors, caregivers. A lot of them are retired. They can volunteer to help with activities that might help to mitigate some of the negative effects of climate and climate change and weather impacts. In terms of youth, youth tend to be kind of more resilient in general. And by building that resiliency, a lot of it, sometimes activism comes out of that, but it's also you're building it for a long lifespan, resilience for a long lifespan, and maybe activism and engagement around actions that need to be taken to help reverse some of what we're doing. And then the indigenous communities, and these are leaders in nature, agriculture, and sustainability because of their cultural knowledge and experience. So tap into that cultural knowledge and experience with the indigenous communities as well. So I'll stop there and hopefully we have some time for questions. And I know Mona, you have to take off, so maybe if anybody has questions for Mona first, and then I can hang in there for a few more minutes too. We also wanted to give you a break as well, so before your 3 o'clock. So.
I know you talked about sort of one of the impacts that we can have is planting more trees, reducing that um, um, heat, urban island impact. What are like some other things that you would want to see advocate for, like in terms of like public policy?
Yeah, and I apologize. I think you had a couple extra closing slides, and you addressed some of that in some of those slides, don't you? Or maybe maybe I misunderstood.
I did, and that's a really good question. I think I'll share that last slide again. I think thinking about co-benefits is probably the best kind of approach to local policy. I- my caveat that I'm going to just put out there is, right, any solution has to be place-based and equity centered, right? So whatever, something that might work here in Tucson may not work in Phoenix, and it's really important to recognize that, or it may not work in Chicago or Ohio or wherever. But in addition to planting trees, I think mobilizing policies that allow or provide funding in particular to have more like school gardens, increase lighting. We've often seen in many communities that you might have a neighborhood park, but if it's not well lit, it's on in an area of town where there is a higher rate of crime, people aren't going to go use that space. So being able to think in that broader lens and trying to figure out, A, do those spaces, community spaces exist? If they exist, working with the community to recognize, well, what are the barriers, right? Is it the fact that there is no bus line? Is it the fact that, it's not a safe neighborhood? So a lot of that, I think you can get by communicating and coordinating with local um, community members. You'll see hospitals are starting to get into this a lot. There's a lot of momentum around the country around relying less on animal food products and going like Monday vegan day or those kind of things. There's benefits to that, but again, my caution is, you know, understanding the local values and reframing these approaches to what could be, easier to implement and to get buy-in from. We're seeing a lot of the IRA funding that's going into more infrastructure change. So, we want to have people drive more electric vehicles, but they're not affordable. And then there's the logistical reason of, well, there's no charging stations. So I think those are at one end of some of these kind of policy changes. But what we're there's a lot of different work that we can do, but one kind of way to look at it is if any policy can address social determinants of health or health inequities, then it's a win-win situation because the root cause of any type of stressor, climate change, or even any of the health issues you see in your communities, obesity, diabetes, cancer, heart disease, they're going to boil down to the same exact thing, which is the same people who are vulnerable for one are vulnerable for another. And if we're not addressing those root inequities, we're really, we're not addressing the root cause of the problem. Does that help, David?
Yeah, it does. Thank you.